What's going on, guys? I'm joined today with our Director of Sports Medicine, Dr. Taylor Comfort, who is in the house to discuss our sports med product here at Triple F. Taylor, how you doing?
I'm doing good. It's been a year since I've been on this thing, so I'm excited to be back on the mic.
A whole year. You actually tracked it down and looked back at the last episode?
I'm tracking it down. I want to be on this thing a little bit more frequently, so let's have a good one.
Yeah, this is long overdue for sure, and not sure why it's taken us this long, but naturally with it being the third week of August and starting to see just the kind of onslaught of preseason and in-season sports med and ortho things, this has become a hot topic as of late, just on the floor and the things we're seeing with kids. So, but not to mention just reminding people of the sports med department here and how we actually provide the care that athletes need that they just really don't get outside of these walls for the most part. And so that's what we're going to dig in today. Really the first point I want to make as we kick off this conversation is going back to about 2 years ago when this place first opened, and Lee and I trying to figure out all of the offerings that we were going to have as part of our membership with the first, and I'm not joking on this one, I mean, we knew we were going to train athletes, but the first thing and the most important thing that came to both of our minds was how can we offer real sports med care to our athletes as part of their membership, something that they never have to worry about, because train like a pro, it's a cool tagline, but it really means like you have all the resources you need to be successful the same way that a pro athlete would. Pro athletes aren't worried about when they go to the practice facility whether or not they're going to have their therapist or their trainer, there to take care of them or look at them or ask them a question about something. It's just part of the daily life of a pro athlete, and that's all Lee knows. He's relied on that so much over the 11-year career that he had with the injuries and just the little things that are almost daily that you encounter as an athlete with being an athlete, and being on the field. But then for me personally, why it was so important to me as a strength coach, I know that that's not my domain. I know where to draw the line. Some people don't. Some people kind of go back and forth between the two and decide to become, certified and these other things. For me, I'm like, if an athlete comes up to me, he's like, "Coach, can you do some cupping on my arm or something?" I'm like, no, that's not what I do. Mm-hmm. My job is this. Let's go grab the therapist and allow them to do, what they've spent so much time learning how to do and are an expert in and are experienced with that for you. And so I knew that going into this, that was essential because I didn't want to be caught in a situation where I was having to do something that I was not an expert in, or that I was not trained in, and it's necessary because I knew it was going to be inevitable. I knew there was just going to be situations where an athlete would need treatment, and all I've ever known as a college strength coach and a high school strength coach is how to work with our sports med department to provide the ultimate plan centered around not only their training needs but also their sports med needs. So, with all that being said, I just would love for you to summarize kind of our sports med offering, what it looks like, how athletes can take advantage of it, and just maybe even drop in a little bit about yourself and kind of your background for it.
Sure. So I'll start with my background. So I've been treating for about 8 years, and after a couple of years, I went and pursued my board certification in sports physical therapy. In doing that, I worked minor league hockey for a couple of years, did some stuff with football, and did a research project in overhead athlete and like velocity programs for baseball players. From there, I went and pursued a board certification in orthopedics, and so only dual board certified therapist in the state of Tennessee.
Yes, sir.
And currently running a business, Onward Physical Therapy, here in town with a couple locations. Also doing some work with USA Weightlifting. We had a good run in the Olympics. Had a couple medalists. It was great to see. Awesome. And then I also teach for a couple of different universities, and so always in the research, always trying to get better, and making sure that the product that I'm putting forth and that my team's putting forth is going to be educational based and scientifically based, and to have the best product that's going to get people back on the field or keep them on the field while they're dealing with some stuff. Okay. So when Lee asked me a couple years ago to join the sports med program, he made that pitch of train like a pro. This is our mantra. This is what we want to do. And I asked him, what does train like a pro mean? He said, when these kids are in the room, I want them to feel like they're in the locker room, with the Raiders, with the Bills. I want them to have all the resources available, so that they can get on the field, stay on the field, and make their membership really truly valuable. And this was a piece that he was like, I've looked at other products around the country, and nobody's doing this. Yep. This is the piece that's going to be the separator.
At least not for kids anyway.
Not for kids, correct. And so this is going to be the separator. This is what's going to be the difference maker of why our product's going to be elevated. All right. And so we looked at the different options. Like, do we bring an athletic trainer in? Do we keep it with PT, PTAs? Like, what is the rehab going to look like? And truly, what it boiled down to was we wanted to have somebody to have the ability to evaluate, the ability to take them through. If we have somebody that needs post-operative care, we'll take them all the way through. We need somebody that has some deeper roots in the area, so to be able to communicate with the different orthopedic groups in town, with the different athletic trainers at their school. And so we ended up going the PT route. And so myself and then Dr. Doug Manning, the two of us are kind of running the sports med operation right now. And both of us are sports trained and have good communication throughout the community. And truly, like, that's one piece that is what I value the most, is our ability to communicate with not only the other athletic trainers in the area, but with the other with the orthos, but with the coaches on the floor. Yep. We utilize that communication system more than anything. Of, hey, Johnny's having some trouble with this lift. Taylor, what do you think about making an alternate for these lifts? And so we have a nice communication system where we're constantly going back and forth, and whether it's text, whether it's through our electronic medical system, like, the communication is at a peak point to where they don't have to miss time training. They don't, we keep them on the floor, we keep them progressing, working around an injury.
Yep. So what does it look like for an athlete to see you for how long, and based on kind of like what schedule? What is the exact offering here?
Great question. So Tuesday, Wednesday, Thursday, we offer evening slots. So 6 to 8:30 on Tuesdays and Thursdays, and 5 to 8 on Wednesdays. And so both myself and Doug Manning are available. All they do is go into the app, log in, register just like you'd register for a class. You just pick, if it's the first time you're seeing us, pick that initial evaluation. If it's a follow-up, we have a follow-up button as well. We're not seeing anybody. We're not seeing a huge volume of people. All right, so we're not going to be like one of 5 people that's going in at a given time. Yep. We are limiting it to 2 slots per half hour, and if we need more time, we can book out like a second slot if we need that. If we need to go a full hour, but we can get a lot done if we're really dialed in and really focused on the care that we're trying to provide by doing that 1 to 2 people at a given time.
Yeah, especially now that you have so many students around here helping out,
Correct.
A PTA every now and then, or just somebody that's in the building and the other room upstairs that we have. We
Absolutely.
basically have a clinic here, full-blown clinic with everything you need and all the things you've invested in to outfit that space for kind of a more intimate setting with whatever rehab needs we come across.
Absolutely. So to speak on that upstairs, so we did branch out, and my business, Onward Physical Therapy, does now have an operating clinic upstairs that runs 7 a.m. to 7 p. Monday through Friday, and so that is not part of the membership. So if people need like more detail than what they're getting downstairs, then we have that option for them. Yep. But so much can be taken care of downstairs that it's more of an outlier situation for these members to be needing to use the upstairs clinic. But yeah, downstairs we can get a ton done.
Yeah. So on that note, describe what a typical treatment really looks like, what it typically is, with the things that athletes come to see you with, because they'll book a treatment and you may have no idea, why they're booking it, and they'll just present to you in the moment what their symptoms are and what's going on. So how do you go about actually treating kind of the more common things that you see, and how is that different from what an athletic trainer would do at school?
Sure. So PT versus athletic trainer both have a very unique set of skills. Athletic trainers are great in the acute situations of a player goes down on the field. They're phenomenal when it comes to that acute assessment. PTs are gonna be more the clinical based. Like, they're gonna do more. It'll be I will say a little bit more thorough evaluation, but it's going to be more clinically based versus the on-field triage aspect.
It's like the first responder paramedic versus the nurse,
Correct.
the registered nurse,
Correct.
Something like that.
Yeah, and so one big difference on our end is I don't have 80 athletes to get taped before practice. All right, so again, when it comes down to me seeing 1 to 2 people an hour or per half-hour slot, I have so much time to dial in and be super specific with what we're trying to do to keep those athletes going, versus, I've got 6 people doing some TheraBand exercises over here, and I'm taping 2 ankles over here, and I've got other people just trying to stretch over there, and I'm trying to make bags of ice at the same time. It's just the product of an environment. Yep. All right. So, I mean,
there's no surprise, and it's nothing new that athletic trainers are extremely spread thin.
Oh, absolutely.
For what they offer, and God bless them. It's a tough job.
It is a thankless job. They're working nights and weekends. They're on the field in the heat. Like, I commend every single one of them that steps on the floor. They also just don't have as much time as what I do to get the job done, and so that's just another value piece that we can add.
Yeah. So what then does a typical treatment look like for you? Like, what have you been seeing lately?
Yeah. So early season, a lot of people are coming off of like, oh, maybe I should have worked a little harder in the off season, and we're getting some of those soft tissue injuries of the hamstrings, the calf strains, and some things like that. That it's more managing soft tissue pains and teaching them how to load appropriately to recover, but still work out, still be on the football field or soccer pitch, but at the same time, like, understand that it's okay to modify, but we're not shutting down. Yep. Like that is a big mantra that anybody on my team and affiliated with me, we are going to do anything in our power not to shut someone down for a time. People have worked too hard not to, and so we don't want them to lose all the gains that they've made. So initial assessment. I'm gonna take you through the body chart. I'm gonna find out where all your pain points are. We're gonna go through an objective exam with each one of those, and we're gonna find out what are your aggravating factors, what are the easing factors. And we're gonna build a plan together. It won't be an incredibly, we're not giving you 15 exercises to do. I'm gonna give you the 2 to 4 things that are gonna make the biggest impact on you right away. From there, if you want to book the next day, come on in. We'll already have it documented. We'll know exactly what we assessed. So even if you saw me one day, Doug the next, we know exactly what's going on and how we can piggyback off one another. For those who are following up that have already seen us, we're going to reference that chart. We're going to retest a couple things. There's always a few pieces that we saw in the assessment that we want to go back and look at. That's when we're going to hit those real quick, and then we go right into treatment. Treatments we offer from a manual therapy side, we'll do some soft tissue work. If it's somebody who's okay with like joint popping, people call them adjustments, like some of those thrust manipulations. If we're okay with that, we're fully trained in those. Cupping. I'm not comfortable doing dry needling without parental consent. I just want to make sure that we make that very clear. Like, I'm not sticking anybody with needles who I don't have parental consent, and it's been very very cleared on the medical side. But all of our therapists are trained in that as well. And then we're very big on loading principles. I want to make sure that I'm communicating with the coaching staff, and that we're really working with that coaching staff to make sure that we're continuing to load through and around an injury.
That's really good. And one of the things we've built in with our system that has really been kind of a dream come true logistically, of like, how do we take what the athlete is experiencing, from a clinical standpoint, and it be documented, but then have it really seamlessly dial into and adjust on the floor, because it's not just sticks together and it happens. Like, you actually have to make sure that communication line is real and that it's communicated, consistently, because we have multiple coaches around here. So, one way, or the way that we were able to establish that, was with the athlete cards. So every athlete has a card. It's based on the new kind of phase that we're in of fall 2024, phase 1 that we're in now. And there's a little spot at the bottom right, that shows whether an athlete has been seen by you or the staff, and if so, what their limitations are, if any. And so each Monday, and throughout the week, as things come up and you see so many athletes, which now you're very busy, with all the things you're seeing. We have a little sticker that you put on there, and the printout tells us exactly kind of what's going on and what your modifications or your suggestions are. There's so many people that don't really know how awesome that is, just because the therapist and the strength coach are truly working hand in hand in a systematic way that is both essentially it's kind of a 24/7 deal. I mean, even in our Slack channel with the staff, like anything from a medical standpoint that pops up, we have that conversation. Or we heard somebody broke their collarbone, or we heard somebody messed up their ankle. I mean, it's a quick, hey, would you mind reaching out, Taylor, just checking in and seeing, what they need. And so I just hope and things are only going to get better, that people just see the value of it for what it is, and it just can't be stressed enough about how amazing it is. And it's just so cool to me, because I've been in many situations where we didn't have a great relationship between sports med and the clinical side, and the strength and conditioning staff or sports staff. And so I just love our working relationship, and that we really are a team. Like, all we care about is the athlete's best interests, and how can we maximize that. And so Lee has just done such a good job piecing all that together from a facility standpoint, as well as hiring the right people that are humble and just care about kids. So with that being said, as we stress the value of this product, what would you say is like the monetary value of kind of our sports med offering here? Our whole membership, ranges based on kind of the commitment level from a time standpoint of 6 months, 9 months to a year. And with that includes the protein shake, however many training sessions you want, and however many treatments you want. The kids can come and see you as often as they want. What does that look like at Onward? And to take that outside of our membership, what would typically be the cost of something like that?
Yeah. So the half-hour cost for a clinical visit is $85. An hour is going to be $150 with our team. And so if you're coming three times a week to see us downstairs, you're looking at like $270, so you're over $1,000 a month of value that could be there for your athlete. Like, it's not a small chunk of change. Like, we're truly, and we're not like doing these assessments halfway. Like, I'm treating these athletes the same way I'm treating people in my clinic, and making sure that they're. I always tell people, like, I'm going to treat them like my family, and how my family would want to be treated. And so there is a monetary value that is truly attached to it.
Yeah. What's been a really good success story from the past few weeks here with some of the members here at Triple F?
So, Jared Bafford, great example of someone who truly put in the work over an extended period of time. He came in with a post-operatively from a shoulder injury, and a lot of instability, dislocation of the shoulder. And I got a text from his coach the other day that he is just a man on fire right now, and he's completely released. Doc is very impressed. Braden Rivers is another one. Braden Rivers is I'll say he's more of an anomaly. He's an ACL that is coming back off of surgery quite quickly. I'm gonna say in that 4 to 5 month range. I don't like clearing anybody before 9 months, if I'm being honest. But when the objective data is showing me one thing, and the doc seeing the same thing I'm seeing, and it's just a testament of the great work he's put in, the time he's put in, the effort he's put in, and
a lot of 6:15 a.m. sessions here in the morning. That's for sure. 3 to 4 times a week.
Absolutely.
Prior to that happening,
it's a testament to both the strength conditioning program as well as us on the medical side of and how this thing really boils down. There's another scenario. I'm not going to use names on this next one, but we were able to pick up on a health concern, and making sure that somebody's medically cleared before stepping on the football field, and truly, like with the scenario that we found, I commend this athlete for coming up to us and saying, like, hey, like something doesn't feel right. We talked to the right people, and now we're after talking to the different specialists, like may have saved a life.
Yep.
And like that's we talked about price a second ago.
Yeah,
there's truly no price on that. Like I've worked plenty of events where we have athletes go down unconscious. We had some life versus limb situations, and it's not a time that we want to put ourselves in medically. And so, like just knowing that our athletes are starting to trust us at that level to be like, hey, I know you're not gonna tell my coach and I'm gonna get benched or anything like that. Like it's just truly like we care about these people as if they're our own family.
Yeah. And just to piggyback on that one, because I know if he was in here, he would be totally fine with us sharing kind of that story because of just how really amazing it is and what God had kind of pieced together in the circumstances to allow us to catch that. But how cool it was that really within an hour or two time frame of him sharing that with me pulling his butt over to go see you, and a phone call that you made for what was an issue for him to get seen and get properly treated from these same symptoms for months pretty much happened within an hour. I mean, you were able to get him where he needed to be to get the right testing, and everything just seemed really quickly expedited because it was as serious as it should have been. And then on my end, for me to text the coach who I'm close with and say, hey, this is what's going on, and just the true connectivity that every athlete deserves to have, but not every athlete gets between therapist, strength coach, and the head coach and everybody else that's involved, parent who was in the parking lot. And we said, hey, let's talk about what we've seen and what's going on, what you recommend medically. And for that to be resolved pretty quickly is something that I'll forever be proud of what we do here. And just because you and I have seen some things, we've been in this profession long enough to know what not to do and what to take extremely seriously. And that comes from experience, unfortunately, of some bad things that we've seen in our past. So there's just certain things from a medical standpoint that you don't want to mess with, and why we're sitting here in this room right now having this conversation about the value of what this is, because it's pretty dang important. We're talking about the rest of your life. And if you have a botched rehab or something that was supposed to not be that major, but you decided to jump in and play a little too soon before like the tissue was truly healed, or kind of going beyond medical advice. I mean, you're talking about the rest of your life that could be impacted by it. And so the educational piece of what we do for kids and for parents to bridge that gap of like, here's probably the best decision that you can make. Like, I know this is the decision you want and the timeline you want, but here's probably what you should do. And so just maybe, if anything, as we wrap up, kind of touch on your passion to educate our parents and our kids and what that looks like going forward, with maybe some webinars that we can host and some things that we can do to help people make the best decision. Do I call Dr. Comfort at Triple F, or do I call my ortho? Do I call my pediatrician? Just what it looks like to help guide the parent as their first line of defense, if you will, as the sports med professional and offering that we are, versus kind of them being lost, on their own of what to do.
Yeah. So I would say the easiest way to communicate, and I would say the best way, most efficient way to communicate, is going to be to email me. It's medical@triplefknoxville.com. So that I will check that. That one's queued to my phone on a regular basis. So that's the best way to do it. And if we need to expedite it to a physician, I put my ego to the side. I want to make sure that the athlete's taken care of and things are gone to the right people at the right time. Yep. As a PT, especially as a sports trained PT, I am fully capable of handling any musculoskeletal disorder as a first line of defense. We screen things very thoroughly, and we know when to send for imaging, when not to, and we don't mess around with it. All right. So like from a transparency standpoint, I will always be as blunt as I need to be. I will be nice about it, but I will be blunt. I won't try to hide anything to save feelings. Like you will know if there's a concern. All right. And so I want to make sure that part's very, very clear there.
Yeah. No, that's huge. So just one kind of final summary, if I'm a parent of a Triple F athlete, we have a membership here. What I thought was mostly just training and all the offerings on my tour, because we walked around and saw this amazing place and all this great technology, and I met the strength coach, and I probably met Kevin, and I know a pro athlete invested in this and owns this place. What would you say as being the greatest value add as having this safety net, if you will, from a sports med standpoint? How would you just kind of quickly summarize to me and maybe sell me as a parent who really hasn't experienced a lot of sports med issues with my athlete, but like, what would be kind of your summary of what that offering is and how valuable it is to have that as part of this membership?
So I'm going to say the most valuable piece to this membership is when your athlete's injured. And I say that because a lot of places they're going to say like, "Oh, well, we're just going to charge you for not showing up to your sessions," that type of thing. When people are injured, that's when we shine. That's when my team is at its best, and that's when we're going to make that membership valuable, like value to skyrocket.
Yeah.
All right. So again, we talked about not shutting people down, but finding ways. If we need to modify, if we need to hold an exercise, we will. But let's give an example of an ACL, a knee. So if someone goes down with that, they've still got 3 other working limbs and a great core that needs to be trained. All right. So that is our specialty. That is where we come in to elevate our level of communication to the coaches and truly provide that piece of taking an injury of what would typically sideline somebody and make them pause a membership. That's when the membership is most valuable. And truly, when it talks about, like when Lee talked about train like a pro, that was the piece that we really hammered down of this is when athletes need to be here the most. If you're typically a 1 to 2 day a week athlete coming in here, but now you're on an injury program, where you're no longer like in practice, 4 hours a day and stuff like that. So your time just freed up. Now it's time to rehab like a pro, and truly like take the next step in that way.
And just off the top of my head, I could easily name 15 to 20 cases in the past 20 years of people that have really taken us up on that. One of which really recently had a knee issue that you experienced when you were an athlete. So I mean, right away it was like, man, I know exactly how to fix this and rehab this. And he was back on the field within a few weeks.
Yep.
From what I thought was going to be like months at a time, or probably needing an operation of some sort. I mean, it seemed serious from my standpoint, and for them to just know immediately, hey, we got to call Taylor. Like it just made the whole process just so smooth, and everybody was just so happy and grateful because this is how pro athletes operate. This is what we know. This is the way it's supposed to be. A bunch of people working together to get you back on the field in the correct way.
Yeah, like when you talk about the train like a pro piece, and I hear it so many times like, well, they're professional athletes, so they've got all these resources to be able to get back on the field from this injury so quickly. So do you. Yeah. We have these same resources. This is like we're the same team that I'm working with Olympians. I'm working with professional fighters. I'm working with professional athletes on a regular basis. We are the same resources that you're talking about. We're here for these athletes. We want to work with these athletes. I don't want to sit downstairs and twiddle my thumbs, man. I want to be there, be doing stuff. I have a passion for this. This is what I've wanted to do since I was 15 years old, and this I finally get the opportunity to do it and truly treat the type of patient that I want to treat. And it's keeping these guys on the field. It's one of those like when you are living your passion and working your passion, like you never work a day in your life. Like that's what I'm living right now.
Yep. And it's pretty cool when there literally is a first round draft pick on the floor getting some treatment by you and and the other therapists. Like it's quite literally the same level of care that a pro athlete gets. And most people just don't, unless it's evidenced by their eyes, and to see like, man, like look over here and you see this athlete in the same room as me getting the same treatment. I mean, it's kind of hard to argue with that, in terms of level of care for sure. So
absolutely.
So cool, Taylor. Grateful for you, man. Thanks for being here, and thanks for investing in these kids and making Triple F a better place. And you definitely make me sleep well at night, knowing that I can
appreciate it.
Push things to you. And it doesn't. I mean, every now and then I gotta, I don't know, buy you a beer, take you out for a burger or something because of just the hours that we just assume that you're available in the life that you live as a medical professional. But you really, can't be thanked enough for your role here. And man, we're just appreciative of you. So
I appreciate it. Down the road, we are planning on doing a few. You mentioned a little bit about webinars and some just in-person workshops. Like I want to make sure that our athletes are constantly getting educated as well. And so kind of be on the lookout for some of that stuff. We're going to be doing, I don't know when this is going to air, but we are going to be doing one on acute injuries and both the physical and mental side of recovery. And I'm going to be partnering up with a sports psychologist with that one. So be on the lookout for these things. Like I'm excited to truly not just share like physical like skill set and help with the athletes, but I want to make sure that they're well equipped on the emotional side and mental side as well.
Yeah, I'm excited for that, man. It's going to be big time for the community. So, well, cool. Well, thanks for joining us for this little interview here, and look forward to seeing you for some future episodes with Taylor and all the phenomenal modalities that we offer here, and just explaining a little bit more how that works. And yeah, it's just going to be great to see him flesh those things out, and for our athletes to continue to get the best care that we can provide them. So thanks again, Taylor, and we'll see you guys next time.